Bonjour tout le monde, bonne année.
Happy New Year.
Alors qu'on débute une nouvelle
As
année,
we are starting a new year,
bien
I
des
know
gens s'attendent
that many
de
people
voir ce qui leur
are
attend en
expecting
2021.
what's going to happen
Même
in
si on est bien
2021.
loin d'en avoir
Even
fini avec la
if
pandémie,
we're very far
je
from
commence
ending the
aujourd'hui en
pandemic,
disant
I just want to
qu'il y a
start
des
today
raisons
by saying
d'être
that we've got
optimiste.
reasons to be
Deux
optimistic.
vaccins
Two
sûrs et
vaccines
efficaces ont
that are
été
sure and
approuvés au Canada
efficient have been
et nous
approved
avons
in
déjà
Canada.
commencé à
And we've
recevoir des
already
doses de ces
started to
vaccins
receive
au
the
cours des
doses
dernières
of these
semaines.
vaccines in the
Notre
last few weeks.
gouvernement a
Our
travaillé
government
sans
has
relâche
worked
pour livrer
relentlessly
près d'un
to
demi-million de
deliver
doses de vaccins
almost
aux provinces
half a
et
million
territoires le mois
doses of
dernier.
vaccines in the provinces and territories in the last month, and the
Ces
efforts are
vaccins
going
permettront de
on.
protéger
These
les gens
vaccines will
et de
permit to
sauver des vies.
protect people and save
C'est
lives.
pourquoi il est
This is why
essentiel
it's
que les
essential
provinces et les
that
territoires
provinces and
mènent leur
territories
campagne de
lead their
vaccination
campaign
le
of
plus
vaccination
rapidement possible.
as soon as
Le
possible.
gouvernement
The
fédéral
government
prend
of
en
Canada
charge
is
le
taking
prix des
in charge
vaccins et des
the costs
fournitures
of vaccines
nécessaires
and
pour
the
les
necessary
administrer
furniture
et
to
par
administer them,
l'intermédiaire
and
des
by
centres
the
du Centre
intermediate
national des
of the
opérations
National
et
Center
soutenu
of
par les forces
Operations
armées
that is
canadiennes.
sustained
Nous
by
assurons
the
la
Canadian Armed Forces.
coordination des
We're
aspects
ensuring
logistiques
the
du
coordination and the
déploiement des
logistic
vaccins
aspects
partout au
of
Canada.
deploying the vaccines everywhere in the
Since
country.
Canada approved the first COVID-19 vaccines just a few weeks ago, we've already delivered nearly 500,000 doses to the provinces and territories. We're on track to have well over 1 million vaccine doses from Pfizer and Moderna by the end of January. And by September, we'll have enough doses to vaccinate every Canadian who wants a shot. This pandemic will end. We will get through this. Better days are on the horizon, but to get there, we need to keep holding on. Je l'ai dit et je le répète.
I've said it before, and I'll say it again. This is not the time to vacation abroad. We need to hold on and be strong. And I would like to discuss the Canada Recovery Sickness Benefit. The goal of this benefit is simple: to enable workers to take paid sick leave if their employer doesn't offer it. For example, this benefit is for a grocery worker who needs to quarantine because they entered into contact with a colleague who tested positive, or if the grocery worker themselves has symptoms. That way, the person doesn't have to choose between losing income and protecting others by quarantining. The objective was never to send a check to those who decided to go on vacation at a time like this. My message to those who have traveled in countries in the South is clear. You will not receive this benefit. It was not prepared for you. For those who are upset reading the reporting over the weekend, I share that frustration and anger. We are correcting the situation quickly. I know you have made many sacrifices. What we need to remember for now is that those who are traveling for non-essential reasons will not be able to access the Canada Recovery Sickness Benefit. Since March, we have been telling Canadians to avoid all non-essential travel, and we are continuing to repeat that message. There is also a mandatory quarantine for all those who return to Canada without exception, with very severe legal restrictions if the quarantine is violated. The checks and measures that we have placed at the border since March are some of the strictest in the world. That's important in order to protect our loved ones, health workers, and to ensure that our hospitals not be overwhelmed.
Has long had some of the strongest travel measures in the world. Since March, these rules have helped save lives. As new strains of COVID-19 emerge, as cases skyrocket in countless countries, this is the time to double down on keeping you and your family safe. Starting Thursday, to be eligible to return to Canada, travelers must have a negative COVID-19 test before boarding their flight. This is in addition to the long-standing mandatory 2-week quarantine once people arrive. Officials are reviewing travelers' isolation plans, and if the plan is not up to par, the travelers will have to quarantine in a federal facility. Earlier today, I also spoke with President Ramaphosa of South Africa, including about our work together on fighting COVID-19 and the global response to this pandemic. Canada and South Africa have long worked as partners to keep our citizens safe and build a healthier, brighter future for everyone. As we face this pandemic, we will continue to stand together. This includes on fighting the virus and on ensuring that no one gets left behind as we rebuild. On public health in particular, Canada is taking the steps needed to protect Canadians and stop the spread of COVID-19. We've put in place additional screening and enhanced measures to respond to new challenges wherever they occur around the world. We've been very clear. No one should be vacationing abroad right now. But if you still decide to travel at your own risk, you will need to show a negative COVID-19 test before you return, and you must self-isolate for 2 weeks when you get back. You need to take this seriously. Not following the rules could mean real consequences, including fines and prison time. Let me also be very clear about the Canada Recovery Sickness Benefit. It is not intended for travelers who are quarantining when they return from holiday. This program was created to give people sick leave if they needed it and otherwise wouldn't have one from their employer. It's not there to pay for someone's post-vacation quarantine. We'll have more details soon, but anyone who traveled for non-essential reasons will not be able to access the sickness benefit. So many people gave up so much more than just a vacation over the holidays. There's a reason so many Canadians made those tough but responsible decisions. There's a reason so many Canadians did their part. It was for the people around them, for the senior that is better protected, for the frontline worker who's safer on the job, for the small business owner who could look with more confidence to reopening. We can't let the sacrifices we've made over the holidays and over the last 10 months go to waste. This afternoon, I'll be speaking with local business owners in BC and PEI who are working hard to keep employees on the payroll. Later, I'll also have a chance to drop in on a virtual classroom with students in Edmonton. As a former teacher, these classroom meetings are among my favorites. Our kids are doing an incredible job of not just adapting, but also looking out for each other. So to all the kids doing virtual school this year, and with a lot of you starting up this week, you're doing great. Keep it up. And remember, even as you're trying to figure out how to get virtual school going, this is tough for your parents too. So maybe give them an extra hug at the end of the day and maybe for once do the dishes without being prompted or asked to it. We're all in this together, and the more we can all help each other out, the better we're going to make it through this. Right across the country, people of every age are doing their part. Now is not the time to give up. With rising cases, many provinces that have already made tough decisions will have to continue doing so, whether with local restrictions or province-wide shutdowns. It's not easy, but it is necessary. Our government will be there as a partner for all orders of government as they make the right choices to keep people safe. Working together is what will get us through this crisis, because we're not out of the woods yet. On New Year's Eve, there were over 8,400 new COVID-19 cases reported in Canada. The day before, there had been almost 7,500 cases. These aren't just numbers. Hundreds of families are grieving someone they lost over the holidays. Thousands more are worried about a loved one in hospital. Countless paramedics, nurses, and doctors are struggling to keep up with new patient after new patient. That's what's at stake here. That's why your choices matter. En portant un masque, en gardant vos distances, et en évitant
By
les
wearing a mask,
rassemblements,
physical
vous assurez
distancing, and
votre
avoiding
sécurité
social
et
gatherings,
celle des autres.
you are keeping yourself and
En
others
utilisant
safe.
l'application Alerte COVID,
By using the
vous
COVID
contribuez
alert
à freiner
application,
la propagation de la
you can
maladie.
contribute
Prenez
to
par
slowing the
exemple
spread of
jeudi
the illness.
dernier, quand des centaines de personnes ont entré leur code unique dans
For example,
l'application,
Last Thursday, hundreds of people entered their unique code into the application after receiving a positive test result. That simple action will help prevent hundreds of other people from catching the virus. The struggle against COVID-19 is something we need to do as a team, and we will get through this pandemic. Over the last few weeks, our government has provided additional support to the communities that needed it. For example, the Red Cross in long-term care in Quebec and the Canadian Rangers in the Quanishit First Nation. And we are ready to do more if necessary.
Especially in Ontario, long-term care homes are facing extremely concerning outbreaks of COVID-19. This is unacceptable. Our elders, our parents and grandparents built this country. They raised us, and they deserve the very best possible care. We've already lost too many elders in long-term care. The tragedies of the spring must not be repeated. So as we have been since March, our government is here to support provinces in getting the situation under control in their jurisdictions. Already, we've been in touch with the Government of Ontario and stand ready to provide additional targeted help. Today, just like when we first deployed the armed forces and the Red Cross during the first wave, our top priority is keeping people safe. I'll be bringing up long-term care homes with all premiers on Thursday at our First Minister's meeting, as well as shared work on vaccine distribution and measures on borders and travel. We're all in this fight together, and our government will always be here to do our part. An armed forces deployment, boosting testing, isolation measures, this can be the difference between local outbreaks becoming a crisis or becoming under control. I think of when the Shamattawa First Nation in Manitoba requested emergency support to respond to the COVID-19 outbreak in their community over the past weeks. The federal government deployed the Canadian Armed Forces, who worked side by side with the community on testing, contact tracing, and isolation capacity. And today, cases are a fraction of where they were, and the community continues to work hard to stop the spread of the virus. À tous les gens qui travaillent sur le terrain.
To all those working hard on the ground, whether in the Canadian Armed Forces or the Red Cross, in a hospital or community organization, thank you. You are doing incredible work. We will continue to be there for you. In the weeks and months to come, our government will continue to help those who need it. 2021 will be better than 2020, I promise. But it will still be difficult. Together, we will get through it. Happy New Year,
everyone, to all of us.
Thank you, Prime Minister. Merci, Monsieur le Premier ministre. On va commencer la période de questions aujourd'hui avec le téléphone avec une question, une sous-question. Opérateur, c'est à vous.
Thank you. Merci. Première question, Louis Blouin, Radio-Canada. À vous.
Bonjour, M. Trudeau, bonne année. Il y a un
Question.
sondage léger ce matin qui montre que 48% des Canadiens
Happy New Year.
ont visité de la famille, des amis, qui
A
vivent
poll
en
this
dehors
morning
de
showed
pendant les
that 48% of Canadians visited family outside their town over the holidays. Cases are rising.
de confinement, un possible couvre-feu.
Now, Quebec has considered harsher lockdown measures, even a curfew. Do you believe that this is the right time for that? And even some kind of circuit breaker? Answer. Throughout this pandemic, we have supported the provinces in the difficult choices they must make, and we will continue to do so. I know that that's not what people want to hear. The fact that we're going to have to keep following the rules and undergoing stricter lockdowns in different parts of the country. But since we are at the beginning of the end now with the vaccine coming, this is the time when we need to work harder, be very careful, and recognize that even though cases are continually increasing, we will be able to get through this pandemic if we do the right thing. The federal government will be there to support the provinces as we have been doing since the beginning.
En sous-question, Monsieur Blouin.
d'accord avec ces nouvelles restrictions? Est-ce qu'elles sont inévitables au fond?
Question.
Sur la loi sur les mesures d'urgence, est-ce
When
qu'on
it comes
va
to
donner
the
une
Emergency
opportunité à
Act,
savoir si le fédéral pourrait
the
établir
Emergencies
des
Act,
mesures à l'échelle nationale
my question
pour
is
donner
whether
une
the
réponse
federal
aux
government is
problèmes?
considering national
On est
measures.
toujours en train de regarder
Answer.
tous les outils qu'on a pour aider, pour
We are
protéger
always
les
looking at all the
Canadiens,
tools we
mais,
have to
comme
protect
j'ai dit,
Canadians.
on voit
But,
réellement
as
à
I have
travers le
said,
pays, différents
throughout
enjeux,
the country, there are
différentes
different kinds of issues and
situations que les
situations.
gouvernements local, provincial et territorial
Local,
sont en train,
provincial, and territorial governments
de réagir
are
de la bonne
reacting to
façon.
these different
Moi, ça
situations.
m'intéresse pas du tout
They're
de
doing the right
devoir
thing,
amener
and
une imposition de
I'm not
mesures
at all
d'urgence du
interested
fédéral.
in
Je
imposing
préfère, comme
the
on a fait
federal
depuis le début,
emergencies
travailler avec les provinces pour s'assurer
Emergencies Act.
qu'on est en train de faire la bonne chose aux
Instead,
différents endroits à travers le pays.
I'm
Nous allons continuer.
more interested in supporting the provinces and doing the right thing throughout the
I
country.
think we've seen from the very beginning that we always need to look at all different tools that we have to keep Canadians safe. But like I've said from the beginning, I'm not particularly keen on using the Federal Emergencies Act. I think on a practical basis, the challenges faced in different regions are very different, and one-size-fits-all approach from the federal government isn't automatically the best thing, far from it. And on the other side, we've been working extremely well with the provinces across the country as they've moved forward on the right measures for them. We will continue to work closely with them. I look forward to my First Ministers meeting, the First Ministers meeting of 2021 on Thursday. And we'll talk about all these issues and how we continue to work together on what is right everywhere across the country.
Thank you. Operator, next question on the phone.
Thank you. Merci. Next question, Christy Kirkup, The Globe and Mail. Line open.
Hi, good morning, Prime Minister. Many Canadians are watching other countries roll out vaccines faster, and they're asking why that is the case. And so I'm wondering, what is your explanation to Canadians about the speed of Canada's distribution plan, and what can be done by levels of government to expedite this? We're learning about vaccines, for example, that are sitting in freezers and are not being rolled out to those who need them the most.
I think all Canadians, including me, are frustrated to see vaccines in freezers and not in people's arms. That's why we're going to continue working closely with the provinces, both to deliver vaccines to the provinces and to support them as they need it in terms of getting more vaccines out to vulnerable populations and frontline workers as quickly as possible. We've been able to ramp up over the past number of weeks in terms of vaccine delivery, but now is the time with the new year upon us to really accelerate, and that's certainly what I'll be talking with the premiers about on Thursday, how the federal government can support and help in getting these vaccines even more quickly out to Canadians. Je sais qu'il y a une impatience.
Repeated in French. I know that Canadians are impatient, and I am too. Canadians are impatient when it comes to seeing the most vulnerable vaccinated as quickly as possible. We don't want to see vaccines in freezers. We want to see them in the arms of vulnerable Canadians. And I will be speaking with the provinces and territories on Thursday to see what the federal government can do to continue helping the provinces vaccinate Canadians as quickly as possible. The vaccination programs have been going on for a few weeks now, and now we really need to speed up to ensure that we are protecting the highest possible number of people as quickly as possible. The federal government will be there to help.
And just on another matter, Prime Minister, why did the federal government delay, again, new regulations designed to lower the price of drugs in Canada while facing concerns from industry over how the rules would impact vaccine access?
I think everyone understands that right now our priority is keeping Canadians safe as possible, getting vaccines to Canadians, keeping them safe with cutting-edge treatments, and we're going to focus on making sure we're helping Canadians as quickly and as efficiently as possible and working with industry on making sure that happens.
Thank you. Operator, one last question on the phone.
Thank you. Merci. Prochaine question. Émilie Bergeron, Agence QMI. À vous.
Bonjour, Monsieur Trudeau. Vous avez réitéré votre
Question.
intention de bloquer l'accès à la
Mr.
prestation
Trudeau,
de maladie
you have stated
pour ceux
that
qui
you
ont
will
décidé de
block
rejoindre
access to the Canada Recovery Sickness benefit
Vous dites que vous
to those who have
partagez
traveled over the holidays
l'indignation
and are now in quarantine.
des gens face à ça.
You have said that you
Mais
share
comment avez-vous
Canadians'
l'intention de
indignation
procéder
about this.
et est-ce qu'un projet de loi va être
What are you intending to
nécessaire
do?
pour faire les
Will
changements?
legislation be tabled?
D'abord, il faut se souvenir,
Answer.
ça sert à quoi cette prestation de maladie?
Well, it's very
Si
important to
quelqu'un
remember what the
retourne au
purpose
travail,
of this
tout à
sickness
coup,
benefit is. If
commence à
someone
avoir
is at
des
work
symptômes
and starts
de la
getting COVID
COVID-19,
symptoms,
on ne voulait absolument
well,
pas
we
que cette
really wanted to
personne
avoid having
décide
that
de
person
devoir rester au
decide to
travail
stay
malgré
at
leurs
work
symptômes,
even
parce
though they
qu'ils
have these
avaient pas d'autre
symptoms,
manière de payer
because that's
l'épicerie
the
pour les
only
enfants.
way to pay the
Elle est
bills
là
and feed
pour
their
aider
kids.
les gens, pour pouvoir
So this benefit is there to help
protéger
people. It's
leurs
to
collègues au
help
travail
people
et
protect
les
their
Canadiens
coworkers and
qui rentrent en
Canadians in
contact.
general.
Elle a été créée pour ça et elle a eu
That's what
l'appui
this benefit was
unanime
designed
des
for.
partis à la Chambre des communes
And it
parce
was
qu'on
unanimously
savait que c'était
supported
une
by
mesure
parties in
importante.
the House of Commons
Évidemment,
because we knew that it was an
personne
important measure.
s'imaginait que ça
Now,
aurait pu être utilisé
at the time,
par
nobody
des gens qui
dreamt of the
font fi des
idea that
recommandations de
it
la
could
santé
be
publique
used by
et
people who
utilisent
were
pour
ignoring
payer
public
leur
health
quarantaine
recommendations,
au retour de
people
leur
who were
vacances
simply
dans le sud, quand
trying to use
la
that
grande
money to
majorité
pay
des
for their
gens
quarantine when
comprennent
they
que
get back
c'est
from
pas le
traveling
temps de faire
abroad.
ça. Donc,
When
c'est
most Canadians
absolument
understand perfectly well
inacceptable
that this
et
is
on est en
not
train
the
de
time to be
travailler
traveling like that.
sur
So,
des
of course, we
manières de
agree that it's
s'assurer
completely
que
unacceptable.
ce ne soit pas disponible
And
pour
we
les
are
gens
working
qui
hard to make
reviennent de
sure that this
vacances ou de
benefit is not
voyages non
available for
essentiels.
those who are returning from
On va
non-essential
voir ce que
travel.
ça dire dans les jours à venir, mais
We
je
will
peux
be
vous
giving more
assurer
information on how we are moving forward in the days to come,
avec
but I
acharnement
can assure you that we were working very hard on this.
I think we need to remember what the Canada Sickness Benefit is for. We brought it in place to ensure that if someone comes down with a sniffle or symptoms of COVID-19, they don't decide, oh no, if I stay home, I don't get sick benefits and I'm not going to be able to pay for groceries for my kids. We want them to stay home and we want them to have the support. That's why we brought in the Canada Sickness Benefit. We didn't bring it in and we didn't imagine when we passed it unanimously in the House with the support of all parties that people would use it to pay for their quarantines after having gone south for a 2-week vacation. So that is something we are going to fix right now. We're looking at ways of doing it. I've asked the ministers responsible to come up with solutions rapidly to ensure that it is there to keep Canadians safe and protect people who need this sickness benefit to stay away from work, not as a way of paying for quarantine after a vacation.
En suivi, Émilie?
Oui, bien sûr. Sur les mesures de contrôle
Question.
que le fédéral peut mettre en place
When
dans
it comes
les
to
aéroports,
the federal government's
durant la première
control
vague
measures in
COVID-19,
airports,
vous avez été beaucoup critiqué à ce sujet-là.
during the first wave of COVID-19, the federal government was criticized for its measures on that score. The city of Montreal had sent its own health professionals to check in on mandatory quarantine. Now that we're in the second wave, at perhaps the peak of the second wave, I'm wondering whether the Canadian government is thinking of doing more and suspending flights from South Africa. Answer. First of all, since March, we've brought in measures that were stricter than many other countries around the world. Many other countries that are our allies don't have that, which is a mandatory 2-week quarantine for everyone coming into the country. This mandatory quarantine has been extremely effective. We see that COVID-19 transmission due to travelers from abroad represent less than 2% of new cases of COVID-19. This measure is working very well then. Over the last few months, we have increased measures. There are now on average 5,000 calls every day to follow up on people who are in quarantine. And we are always looking for ways to strengthen those measures, especially given that there's this risk of people returning from holidays abroad. We have also taken measures to ensure that starting later this week, whoever comes back to Canada needs to show that they have a negative COVID-19 test in the last 3 days. That's yet another measure to ensure that people are protected, in addition to the rigorous measures that we have already put into place. We will continue to see what we can do to further protect Canadians. That is our highest priority, whether it be limiting direct flights from the UK or other countries. We will always take decisions based on protecting Canadians.
Since the month of March, we moved forward with a mandatory 2-week quarantine for anyone entering the country. That is something that is stronger than measures put in place by most of our allies, but it has been extremely effective. Because of that 2-week quarantine period that has been strongly enforced over the past many months, we've seen cases of transmission linked to external or foreign travel being less than 2% of all active cases. But we know and we are happy to do even more. On top of enhancing the follow-ups and measures on quarantine, we're seeing about 5,000 calls a day made on ensuring quarantines are being respected. We're going to be increasing those measures as well. But we're also, as of later this week, demanding that anyone returning to Canada demonstrate a negative COVID-19 test taken before takeoff that will reassure us even further that we are keeping our borders safe. In regards to flight restrictions, we will continue to monitor what our allies are doing, what the science is saying. The concerns around various variants around the world are real, and we will continue to do whatever it takes to keep Canadians safe.
Hi, Prime Minister. Kevin Gallagher, CTV National News. I understand that when it comes to helping the provinces speed up the rollout of vaccines, you're saying the Emergency Measures Act is out. A lot of nurses are being told right now, when they're asking about why aren't more doses getting into people's arms instead of sitting in freezers, that, well, the provinces got those vaccines earlier. As you remember, those early doses. So at that time, did there need to be some more federal support to help ramp up this giant vaccination project?
We have been working closely with the provinces since the month of May on preparing for eventual vaccines rollouts. The National Operations Center, the Major General Fortin, who's been working tirelessly on ensuring distribution of vaccines, is ongoing. The benefits of having received hundreds of thousands of doses before we expected them in the end of December has allowed us to ramp up our vaccination programs quicker. We have seen some challenges that I think we're all impatient about in terms of getting those vaccines into arms, but we are confident and very hopeful that over the coming weeks, the challenges will be overcome. And the federal government will continue to work closely with the provinces on ensuring that we're able to get these vaccines out to the most vulnerable and to our frontline workers as quickly as possible. There are many other ways of doing it other than just through hospital centers. And these are things that we're working with and exploring with the provinces on.
You mentioned today that no one should be taking a vacation, but obviously there's 2 members of your caucus who did leave the country. Many other politicians, there's been lots of stories about it, of course, left the country despite this advice that you've been giving consistently. What does that do, in a sense, to the basic public health messaging the government officials are trying to get out?
One of the things that has been really, really important throughout this pandemic for Canadians is the sense that we are all in this together, that we're looking out for each other, because the actions of any one person can have a positive or a negative benefit on the health situation of your neighbor. And this sense of solidarity we've seen throughout this country has been, quite frankly, really inspiring. And continuing to demonstrate that we are there for each other, that we are supporting each other, is extremely important. It's been tough. It's been a long year for everyone. And you know, we need to continue to do our very, very best in supporting them. That's why I was disappointed to find of two of our caucus members who traveled and why there were consequences in them resigning from their committee roles. And that's why all Canadians were so disappointed to see so many examples of folks who should have known better doing things that put us all at risk.
Hi, Prime Minister. Olivia Stefanovich, CBC News. Are you worried manufacturers may slow down deliveries if they see vaccines unused or going to waste in Canada? Is the slow vaccination rate making it hard to lobby for speedy or earlier deliveries? If you can answer in English and French, please.
Let me be very clear, first of all, there is no concern about vaccines going to waste. We have extremely strong measures in place to ensure that the vaccines are properly supported, properly stored, but obviously, for many different reasons, we want to get those vaccines into the arms of vulnerable people as quickly as possible. And that's what we're very much focused on. We will continue to work to accelerate the process safely and to vaccinate as many vulnerable Canadians as possible, as quickly as possible. Not because we're worried about what companies might say, but because we want more and more Canadians to be kept safe every single day. Although the conversations continue with companies around increasing the access to early doses and accelerating the delivery of vaccines in Canada, I am certain that as we work out the challenges currently seen in certain provinces, we will be able to demonstrate that we are doing very well in terms of vaccinating Canadians. And for that, the federal government will be there to support the provinces in working out these challenges and vaccinating people quickly. Je pense que c'est extrêmement important de comprendre que
it's very important to remember that we have protocols in place and logistics that are very rigorous. So we are not concerned that vaccines will go to waste. But we do, of course, want to speed up the process of vaccine delivery as quickly as possible so the vaccines can get to vulnerable Canadians. We will continue working with the provinces in order to ensure that vaccines are delivered as quickly as possible. We will continue to work with the various companies to ensure that vaccines are delivered safely and effectively as quickly as possible. And I will be focusing on that when I speak with the provinces on Thursday.
Do you think it's still possible that the majority of Canadians can be vaccinated by the fall? In English and French, please.
Yes, I'm confident that we're going to be able to get vaccines to every Canadian who wants them by September. That is certainly our goal, and we are very much on track towards that. Je pense que
repeated in French. I believe that it's crucial to be able to vaccinate all Canadians who want the shot by September, and that continues to be our objective.
Good afternoon, Prime Minister. Mike Blanchfield, Canadian Press. I want to ask you about the politicians traveling. How harmful is all of this political travel to convincing pandemic-fatigued Canadians to listen to politicians now, to follow this advice?
I think Canadians have been making sacrifices on a personal level, on a professional level, on family levels over the past many, many months. And as leaders, we've been encouraging and exhorting Canadians to continue to do the right thing. So it is unfortunate to see a number of politicians not take their own advice. I understand and share the frustration that many Canadians are feeling who would have loved to have a little break from all this, but who know that it is not the time to do that. That in order to get through this, we need to continue to be there for each other. We need to follow public health rules. And that's exactly what we're going to continue to focus on doing. Je pense que
repeated in French. Canadians know how important it is to keep making sacrifices, limiting contacts, and getting through the pandemic thanks to these sacrifices in order to be able to reach the end of the pandemic as quickly as possible. It's very important to follow public health rules. And that's why it's so disappointing to see people who should have known better, who nonetheless chose to travel We are in a position of responsibility towards Canadians as politicians. We are responsible for serving Canadians and acting as models, and that is why it is so disappointing to see people making judgment errors.
Prime Minister, are you planning to extend it? And with all these new worrying variants of the coronavirus popping up in multiple countries, are you considering wider bans?
We already have some of the strongest travel measures in Canada since the month of March. Travel to non-Canadians or non-permanent residents has been banned to Canada. We have a 2-week quarantine that is rigidly enforced that many of our allied countries don't have. We also are bringing in further measures around a negative test before someone can now return to Canada. We will continue to look at measures that will keep Canadians safe. We're evaluating the UK ban that is currently in place and seeing whether and how it might be extended, whether it needs to be extended. We will be guided by science and best practices on this, but every step of the way, we will do what is necessary to keep Canadians safe.
David Aiken, Global News. Happy New Year, Prime Minister. I want to think about snowbirds for a second, or seniors in any event. We've learned of a number of them who are traveling to the United States, not for vacation. They want to go get the vaccine there. They think that they'll have a better chance there. Can you speak to this group, to the risks of seniors going to the United States? Can they count on Canada to help them if they need to be repatriated, if hospitals overflow in the U.S.? Can you talk about that issue?
The government of Canada recommends against any non-essential travel. It is safer for people to stay at home in Canada. We are delivering vaccines to the most vulnerable, and we have access to a wider range of potential vaccines and more vaccines per capita than just about any other country. I understand that people are still looking at travel, but we discourage it strongly. There will not be any mass repatriation efforts like we had in March if people are stuck overseas in this time of crisis. This is why we are saying to stay in Canada and stay safe.
Thank you. C'est ce qui m'a fait la conférence de presse d'aujourd'hui.
Merci tout le monde. Bonne journée.